I'm going to go ahead and press it.
Okay.
All right, it looks like we're live on United Medical, Kemal.
Just waiting for the confirmation from my channel.
Okay.
All right, I think we are live from both places now. Good afternoon. It's April 16th, Friday. Our weekly event from United Medical ACO. My name is Kemal Erkan. I'm the chairman of United Medical ACO, and I'm here with Tanner from our business development, and later on, Beste Kuru will be with us. She's one of our senior client managers from RCM side, and will give you some updates. Before we start actually our regular presentation, I have a couple announcements, and then we can start from there. Let's just start my PowerPoint. And all right, so we mentioned last week, right now, any Delawarean over age 16 and over would be able to get COVID vaccine. It's available. You can actually use the link from the state websites, and then you need to have an appointment. You can get it from pharmacies or vaccination events, but your most trusted medical providers, if they are providing the vaccine, would be the right place to go. And the Pfizer is the only vaccine that's approved for under age 18. So if you are 16 or 17, you can get Pfizer, but none of the others. Another news that we mentioned last week, one of our providers and board members of United Medical ACO, Dr. Jonah Gora, she published her first book. This book would be actually very useful for those who wants to be in medical school, and they can understand and see what the process is. And I believe it would be helpful for those. And there are a lot of good stories. I didn't finish the book yet, but I have several copies here for our team. We'll be giving you more feedback on that later on. Well, after two good news, bad news is President Biden will be in town this Friday, and we'll have some road closures again. If you live in Newcastle County, especially around 141, good luck this afternoon. Thank you, President Biden. I hope that we can find a different way to commute, but I guess this is the only way for now. So now today our agenda is going to be with the COVID numbers, the vaccine updates. There are a lot of stuff happened since last week. The Delaware healthcare legislative updates and United Medical management from the RCM side. Those are the updates that we'll be covering. Before I start with this, I'm going to actually, I had the, hold on one second. It is. So let's look at our numbers. The total numbers as of 2 days ago in the United States, 78,876 confirmed cases with 921 people losing their lives. Yesterday, it was still solid 74,479, and with 895 people lost their lives. Today, since it's a real-time data, it's not the numbers are not up to date yet. The concern from different countries, actually, if you look at it 2 days ago, in Turkey, that number is at 16,497, which is a pretty crazy number. India actually now number 2 in the world with the total confirmed cases. Yesterday in Turkey, that number was at 61,000. and India with 216,000 new cases posting. These are extremely high numbers. So we want to make sure that everyone is paying attention if you live in those places, those countries. Now, from Delaware, from our home state, current hospitalization, COVID-related, 155. Last week when we did this session, we were at 145, so it's slightly higher. For new hospital admissions, this is daily. Yesterday, the day before yesterday, it was at 35, and it was 48 the day before. So that's kind of fluctuates. It goes up and down. Percent of persons testing positive, we are at 26%, which is actually much higher than a week ago. Then these are 14-day averages. And then percent of tests are which are positive is also higher, so it's at 6.1%. And then that was at 5.4% last week. And then new positive cases in Delaware is, as of the 14th, we are at 361. And when we look at the number a week ago, it was at 310. So it went from 310 to 361. So that's about 20% increase almost. So after all these bad news, we'll start our presentation. Now, I do want to give some background info for our audience. So we have our provider meetings. These are weekly, Monday and Thursday. And then as we are preparing for those meetings, we also, in a way, we prepare for this meeting. And the updates are pretty interesting what can happen in 1 week. So we'll try to summarize these as much as possible for our patients and for our employees and people who live in Delaware and in the United States. So just going back to the PowerPoint, so let's see. All right, so.
Wow, it looks like it might be the PowerPoint on the other screen.
I did it wrong, right? So hold on a minute. So.
Yeah, now it's up.
Okay. So it's the right one now.
Correct. Oh, it's a little blurry.
Huh?
It's a little blurry. I don't know if that's just me.
On the screen it is, or like
Yeah.
You know what I did?
Okay.
Beste, are you able to read this?
Yeah, it's a little bit blurry.
Oh, it looks like
It's
it came
better now, getting
got
better.
Yeah.
So let me actually just try one other one. When I was doing this time, I did something that says optimize for video clip. I checked on those. I'm not going to do that. I should have done it to start with. How about now?
Yeah, that's much better.
So that means optimizing is not optimizing.
Does not seem to be that way.
No, it is better now. Because from my other screen, I can read it from here. The one that I couldn't read it. So our state rep, David Pence, and Sarah McBride and Brian Townsend, they are actually they are sponsoring this new bill, which will make the telemedicine permanent in Delaware. So this is, I believe this is going to be proposed today, if I'm not mistaken. And the other one that we are going to give you some more updates later on is going to be American Rescue Plan Act of 2021. This is the this was signed on March 11th. It's about $85.6 million for Delaware, which was allocated for 55 local governments. throughout Delaware. So this 85 million, the first half will be available for different projects. And as I was hoping that accountable care organizations would be part of this, I saw this tweet from Senator Tom Carper, extremely disappointing, in front of Christiana Care logo. United Medical logo is also very nice, Senator Carper. So we would welcome you if you would like to promote our organizations. While we are giving 115,000 patients primary care services, we don't want to be under the shadow of any other organizations. You promoting Christiana Care is not ethical. So you have liabilities, responsibilities, and I think you should take those responsibilities more seriously. This is totally disappointing. So why Christiana Care needs to be part of the spending of 16 million is extremely concerning, especially when this is for the vaccine program. Hospitals, Senator Carper's, hospitals are not the place for vaccination. Hospitals are for places for people to get care when they are not able to be taken care of in the outpatient setting. Vaccination for prevention is done in the medical offices, in primary care offices, in pediatric offices, not in the hospital. I strongly recommend you not to promote hospitals when it comes to prevention. And also, like, the cost of all these are extremely important. Christiana Hospital doesn't need your money or the state money. I mean, they make, although they are nonprofit, they are able to make a lot of profit, a lot meaning that 160 to 180 million every year. I'll go into their spendings and other expenses that they have. So why would you need to be part of that? Christiana CEO is making more than 2 million a year. So it's not like they are poor. So the outpatient practices are doing the most work. So I think we can use your help in the outpatient settings. So I know you are really active on the social media, and I'm hoping that you would find time to watch this. But, if you are going to promote one hospital, just take all the hospitals. Take St. Francis, that's a Catholic hospital. They always suffer from financial, issues because they're also under the Christiana shadow. Take Bay Health, take Nanticoke, take BB. But when you single out one hospital, I cannot help but question the motivation here. So let's not do that. So you are bigger than that. I'm going to go back to our PowerPoint. We have some updates. Brian Townsend, one of our state senators, and under his healthcare leadership, we have some discussions with him in these live sessions. We had a meeting this week to follow up on some of our issues, and we are extremely happy to see his support, and hopefully we can go through those and then see the results of those activities from our side. Now, we are going to get into the vaccine updates. I think from the Biden administration, one of the things that we have to admire is the commitment to the vaccine and daily numbers. We are right now at 3.3 million a day, which will take us to the 3 months at 75% of the population will be covered with the vaccination. I think this is extremely encouraging from our side, but I'm going to have Tanner to go through this and give his update for the vaccine for us.
Yeah, thank you, Kemal. I do agree that that's incredibly encouraging to see, especially these are numbers that just a few months ago we were not planning on hitting, at least not nearly this early. So with that 3.3 million doses administered on the rolling daily average for the United States, I wanted to take a look at what does that mean for here in Delaware. So Delaware's latest vaccination rate is roughly just over 10,000 doses per day on average. So at that rate, it would take the state about 2 months to get to 75% of its population. That is, again, as we mentioned, through its current means of with the 16 and over at least now being eligible for the vaccine through some of those mass vaccination events. That's going to only be increased as we do start to get primary care offices and organic systems such as the ACO more involved, which is something that we're continuing to discuss and discuss and bring up with our state legislators and leaders as well. So all of these things are going to be pieces of the puzzle to get back to normal. That's all what's at the forefront of everyone's mind going forward, especially as we are starting to get into warmer weather. I know it's something that personally I've been thinking about, and then everyone is really excited to kind of get back to a sense of normalcy and not as much fear when going out into public places as we are getting into the summer months. So while these vaccines that we do have, or at least with our Pfizer and Moderna vaccines, they're about 95% effective, which is great news, but it's really going to be a mass inoculation that's going to get us to returning to normalcy. And it's something that we've been discussing over the past few weeks, and that's really what that herd immunity is. So coming from the CDC and Dr. Anthony Fauci, we want to get to anywhere between 70 to 85 to really start to kind of feel comfortable with that herd immunity. And as we've kind of seen with the administration rate starting to pick up, we can hoping to get there at some point this summer. So on the global scale, it does mention, of course, that sounds like a very daunting task, and there's a lot of different variables that are going to go into how can we actually reach that number of the population vaccinated, not just here in the United States, but around the world. As of course, that's the ultimate goal, is to make sure that everyone is safe enough to get to the point where transmission rates are going to get low enough to where it's going to be comfortable and it's going to be safe to just go out in public, kind of getting back to some of those normal social norms that we are so used to. So the U.S. is actually leading the vaccination rate at the moment with 3.3 million doses. And again, as I mentioned, that's going to get us to 75% in 3 months. So as we continue here at home to increase and to work on how we're administrating the vaccine, it's something that as we do look forward, we want to make sure we kind of keep an eye on around the world as well, as it's the ultimate goal for all of us to get to the same place. So as I mentioned, with the administration of the vaccine, what's going to be a key important aspect to getting up to 75%, 80% of the population inoculated, other than just the means of administration? It's how many players or how many vaccines you have in the race to get people vaccinated. So currently, or as of the past few weeks, we did have those three. I know we mentioned and we discussed here with the introduction of that third vaccine. We were hoping that that would really be what bumped up the amount of vaccines that we could do on a daily basis. So nothing's changed with our Pfizer and Moderna vaccines. You can see that here. We have everything indicated as such. We have had a little bit of a road bump here with the Johnson & Johnson vaccine. So as many of you may know, recently in the news, there's been stories from the CDC and the recommendation to pause the administration of the Johnson & Johnson vaccine due to the possibility of some relationship there with possible clotting. It's stuff that we've seen with the AstraZeneca one as well abroad. I know that that is not something that's approved here in the United States for emergency use and never was up until this point. So we were keeping a close eye on that over abroad, as it's something that is being used in other countries. So we're starting to see essentially a similar issue with that. Kemal, if you're muted at the, looks like I'm muted for a second.
Sorry. So
okay.
With Dr. Fauci's statements, actually, I was watching him last night with regarding the Johnson & Johnson, whether or not it should really pause or it should not have been stopped, or is it going to be long-term?
Right.
Now, in your opinion, do you think it should have been paused, or because it's a very small number, or should it?
Is, and looking at the numbers, as you did mention, it is a very small number. I think that's something to keep in mind as well. I believe with some 7 or 8 million Johnson & Johnson vaccines that have been administered in the United States, the cases that we are speaking on with the related blood clotting come out. I believe there are 6, maybe 7 as of recently that they're starting to take a look at. So that equates to a very, very, very small percentage of people who are developing these issues. And with that being said, what's going on right now is they're still trying to figure out, okay, is this a correlation, causation effect? Is this what is causing that? Or is this maybe a third variable that's kind of in play here? So as Dr. Fauci did mention, this was out of an abundance of caution. It's difficult to tell, Kemal. I'm not entirely sure because, of course, at the end of the day, you want everyone's safety is in mind here, right? That's the point of the vaccine, is to keep everyone safe. So if there could be a possible issue with it, no matter how small that is, it is really something to take into consideration and to at least investigate, of course, and to run these trials.
So I think when the issue is at the, let me actually just show you this. I was just checking some of them. So this is just from today, from Washington Post. So although AstraZeneca has done so much on the vaccination, now world is uneasy over cloud risk, because this is not something minor. So this is extremely deadly. But I think one of the reasons that Dr. Fauci was positioning in the pausing is because they don't also know all the data. Like there may be some more people perhaps actually out there. So they're just going to wait for it, but it shouldn't actually stop the vaccination process. I'm just worried about like what this may have done to the overall vaccination, because there are some people already questioning the vaccine. There's this hesitancy on the vaccine, and then I don't know how this actually is helping from that point. But hopefully it's not going to be something so major.
Yeah, I do agree. I know that in this case as well with AstraZeneca, at least early on, they were continuing to keep an eye on that and to essentially test to see, okay, when these certain cases, is there in fact a link to the cause of the vaccine? But we do run the risk of, even you're seeing it now, like you mentioned in the news headlines, it's really created essentially like an uneasy feeling or slight distrust in some of these vaccine makers, which could extend to some of the others that are again and again still being proven effective, even in now that we are moving into real life world data. So I'm hoping that it's not going to affect the overall rollout of the vaccine. Now, this was something, Kemal, and I'm not sure if you maybe did see something a little more recent.
Actually, I was reading that differently this morning, but it is actually they're not using the AstraZeneca. Okay. Like it's vaccine rollout without the COVID-19 vaccine from AstraZeneca. So it is. So they are not using it in Denmark.
They've completely stopped with the rollout of the AstraZeneca. So this is definitely going to be. It's going to be interesting to keep an eye on forward, especially as we start to learn more information, because especially with the Johnson & Johnson one-shot vaccine and the AstraZeneca, there's a handful of variables that make this or these two a lot more effective in the fight against the pandemic. Johnson & Johnson being one shot, so easy to administer, less logistical possible issues with the administration. And I know the AstraZeneca vaccine is one that's being used in a lot of more underserved countries, poorer countries that are having access issues to certain vaccines. So these are two good tools in the chest, as I mentioned earlier, to fighting the pandemic on a world scale. So it could be a major hit to the vaccination effort, with whether it be just now it's kind of an uneasiness to the vaccine effort as a whole. So it'll definitely be interesting to keep an eye on.
The other thing that last week we actually brought up whether or not vaccination was going to take care of this permanent, and you may remember me telling you that it's not the case. So I think there are some we have some new information that I would like to share. So this just came out. There are about 5,800 fully vaccinated people have caught COVID anyway in US CDC says. Now, 5,800 out of how many vaccination? Do you have that number?
The number as of last I was looking, Kamal, we're at about 70 million people, I believe, vaccinated. Or it for fully vaccinated, I think it's closer
That's
to
about right. It's
yeah,
more than 25%. So the
correct.
5,800 out of 80 million is nothing. And then from the beginning, we were saying that this is not necessarily going to be the permanent solution. Now, there's another one that the Pfizer actually just came out and said that the third dose may be needed in 12 months, like a booster. But I think we have the data on this one? I think we had some extra data on this where none of these people out of the 5,800 were hospitalized. Do you remember that?
That is correct. So that was something kind of then just reflects what you're mentioning. So this is something that we kind of knew was going to happen from the beginning, right? Even with the clinical trials, the efficacy rate is determined based on how many people are then contracting, in addition to those who may have received a placebo but actually received the COVID vaccine. So what that means is with the 95% efficacy rate, there is still going to be a chance of contracting. But as you rightly mentioned, and what we are seeing reflected now in these breakthrough cases that the CDC is determining, they are preventing severe cases of COVID that are going to require like a hospitalization or even ultimately death, which is still good news. So when you see these numbers, it's stuff that we, again, were expecting. It wasn't a one solution. It wasn't going to fix and make COVID go away. And I think that that is what this data is starting to reflect.
And I was just looking for something from CNN for this one. And I don't know if you are hearing some background. So yeah, I mean, we can give more specific info maybe at the next session, but they are, I mean, the result of not having the vaccine would be extremely severe versus like if 5,800 people just got infected after full vaccination, it was about 77 million. I actually checked the number. That's not a big deal whatsoever. So, from the revenue cycle management side, we are going to actually ask Beste Kuru to join us today. We do actually give a lot of updates from United Medical side, but also like all the related news from for the COVID and other stuff. So we sometimes neglect our own core business, and that's our revenue cycle management. Last week, Richa Savason was with us, and she gave some updates. And then I asked Beste to join us and introduce herself first, and then tell us about why UM is doing better than other companies in the same field. So Beste, if you can please introduce yourself.
Sure. Thanks for having me, Kemal. Hi, everyone. My name is Beste Kuru. I am part of the revenue cycle management leadership at United Medical. As a senior client manager, I work with managers setting RCM goals, monitoring trends, and helping coordinate team efforts towards successful clients' account management. I have been with United Medical for over 5 years now. I am ACMP board certified, and I have an MBA as well as Masters in Finance, Healthcare Management, and IT.
You have several of them, right?
I do. Kemal, today I wanted to talk about the strengths of our RCM team, as well as how we ensure increased revenues for our providers. So I am really proud of being part of this team at United Medical. We have extremely talented individuals on our team, and most of them actually hold master's degrees from top colleges and universities. One thing we extremely highlight and enforce at United Medical is continued education and ensuring proficiency in healthcare management. So right now, all of our managers either hold or they are working towards their ACMPE board certification via MGMA. And we also make sure all of our staff members have access to MGMA resources, and we have a strong partnership with MGMA.
Now, can you actually just elaborate the MGMA? There may be some people, they may not know what MGMA is.
Sure. MGMA stands for Medical Group Management Association. They are one of the key players in healthcare management, healthcare industry. They do bring together a platform for providers and healthcare executives from across the nation, and from advocating for providers to providing resources in various fields of healthcare management. They are a great resource. They also sponsor the ACMPE board certification. And that is basically a program where healthcare executives work towards through body of knowledge, varying from, finance to IT to practice management, basically every business related aspect of a successful practice, medical practice management. And once individual pass the board exams, they are board certified.
All right, and then we have several different teams now. They are going through this process, and you were one of the first group that was certified, right?
Correct. Mm-hmm.
All right. So, and what else do we have?
So on the team side, I do want to also emphasize the diversity and inclusivity we have in our workforce. And I'm, again, really proud to be one of the women who make up the majority of our leadership and managers at United Medical, starting with our director, Richa Shah, from credentialing to payment posting to collections and AR, RCM management. We have women leaders at United Medical. We also have a dynamic and efficient approach to work, Kemal. I think especially with the pandemic and fast pace of the pandemic-related changes environment, we proved that we are highly adaptable and flexible. And I want to say we thrive in face of change and challenges, actually. So with your leadership, of course. And lastly, our leadership team has over 50 years of cumulative experience in the healthcare industry. On the next slide, Kemal, are you able to switch?
When I do these drawing stuff, I have to go back to the lead all and.
Okay, great, thank you. So from revenue cycle management perspective, here at United Medical, we service over 100 clients, close to 400 providers across the nation, basically. We have right now, I believe, from 27 different states and including 23 specialties. We have different providers across the nation that we service. Here, I wanted to use this image because this shows the full cycle of revenue cycle management, which starts with patient registration, the steps that are followed in the practice towards AR, denial management, payment posting, billing, collections, and revenue and realized revenues. And actually, more can be reached at your article on LinkedIn. It was a good article. But I want to say what differentiates United Medical is not just routine denial management, because that would be too easy, right? Here we do really have a holistic approach to revenue cycle management. So we try to fine tune our processes, we audit our work, we ensure quality and accuracy of our team's work. But we also look at the metrics always, and we try to realize increased revenues, ensuring like the KPIs basically improve over time. Kemal, it's, I think, very important to also mention how much effort we put into provider advocacy rights. especially with the payer relationship management we have. It's not only the denials we work on, but we are here to advocate the rights of the providers to make sure that they are getting reimbursed at the rate that they are promised, or they must be reimbursed for the services that they already rendered. For their patients. And while doing that, we try to ensure always patient centricity.
So, I always say that this is our core business, revenue cycle management. We used to call it medical billing only, but it got more complicated in time. So when I started, I was an intern in Delaware Cardiovascular, May 2000, year 2000, and that's about 21 years almost.
Almost your age, right?
It's my age, right? So, um, so that time versus now, what needs to be done in the medical billing world, actually it changes day and night. So the complications, requirements, that's why we have to pay a lot of attention to the education of our resources.
Mm-hmm.
And something that I started initially, it wasn't enough with one person, and it needed a lot of other people who have similar education background and experience from in the field. So now we have an extremely strong team helping our clients nationwide. So that's extremely important. So also understanding our clients. So one, that's one of the things that I always say, autonomy for our physicians is extremely important. So that's why they want to be in private practices. What we were able to actually recognize early on is what the client wanted to do, where they were happy, and then if we can actually complement them rather than competing with the client or trying to take their autonomy away. Like the hospital systems, all they do is as soon as they buy the practice over, it becomes this employment issue, and physicians are not happy in the employment, that type of employment setup. So that's what United Medical is able to provide for our practices, and I'm actually extremely happy that we are able to keep that up. And I always say I'm not going to be too humble about, if it wasn't for me, there wouldn't be this many private practices in Delaware, and that is actually very true because we know, and in the last 5-6 years you've been here, you have seen hospitals taking over private practices. 4 of our surgical practice were taken over by the hospital, and the surgeons became employee of the hospital. But we were able to keep the biggest bariatric group, CRIAS, Christiana Institute of Advanced Surgery, as they're our partner in the American Surgery Center. But just, how it becomes more complex, right?
Mm-hmm.
So it wasn't about just the billing part of it, but it was also about...
it is never just the billing part, right?
So, although what we have to always remember is the billing is the core business, core service that we have, but sometimes it's easy to get sidetracked with all the others. But luckily, we have a great team, and the team actually have not only in the revenue cycle management, but from the operational side, from the business development, we have right people in place, and with the accountable care organizations. One thing that I wanted to actually share while we are talking about the revenue cycle management is this piece here. Right now, we are actually sending our application for the Medicaid ACO, although we are the first ACO who work with the Medicaid MCOs in the state of Delaware.
Mm-hmm.
We have to still get certification for Medicaid for the central office. So this is the program that we have to put together. Although again, we are a billing office, right? So we are a revenue cycle management service as our core business, but all these stuff are happening at the same time, because if we haven't done those, then we wouldn't be able to keep those clients independent. It's extremely pleasing that we are able to.
Kemal, I'm actually really happy that we are doing always our best for, well, improving the health of our patients and also ensuring, everything is smooth for our providers. Correct me if I'm wrong, only in Delaware, we manage over 250,000 patients, right? Through the United Medical ACO, we manage.
So total number of patients we serve, it's probably even maybe more than 250, but just from the primary care level, pediatric and primary care level, that number is about 115,000, which at that level, it's extremely strong. And but sometimes we don't get the right recognition or fair recognition. Just like Carper going to Christiana Hospital, while President Biden goes to Christiana Hospital logo, we could have vaccinated him in our offices, and trust me, I would probably not put the logo behind them because I would try to protect them. But there's a different understanding. It's fine. There are politicians and they need to get their own satisfactions, but from our side, we are serving our society. That's all I care. We are serving. We are providing service for our residents in Delaware from the clinical side, and our clients around the United States from 27 different states, and that is extremely pleasing from our side. Now, one other thing that I want to share from United Medical side. Right now, we have the new blog that our marketing team actually put together. This is available through our website, and then they have already started posting. These are on top of the articles that I used to write, and I still write some. But this is very nice, actually, the way that they put it. And I want to make sure that our audience is able to see them. Now, from the digital health record side, we have all these events through our channels available, our media channels available, and I'm hoping that our patients and people in the United States or around the world, they find this helpful. Now, this event is going to be as it's been happening, it's going to be at 12 noon. And one other thing I want to share with you guys is we kind of forgot that for today, but we have this Friends of Tigray Delaware is one of our nonprofit organizations that we set it up to voice out the issues related to Ethiopian conflict with Tigray. And what's amazing with social media, and I know you actually, interesting enough, although you are in the RCM side, you do help the marketing people a lot, and including myself, so I get a lot of good feedback from you. Well, not good feedback, but useful feedback sometimes.
Okay, great to hear.
It may not be good, but the power of social media is extremely important, and we want our people to understand this. This is 1 month reach from Friends of Tigray Delaware. This is about 387,000 people we were able to reach, and actually, if I can make this 7 days, that's 314,000 is since the last video we have done for Tigray. And the only unfortunate part is that Tigray is still suffering. I know that you guys are following that as you are supporting some of my events. So we are hoping that we can see some resolution in the next couple of days. But just from the way that we are communicating with our patients, I find this extremely helpful for us to be able to reach out to others and also see what can be done at different levels. And thank you guys for being part of this and
Of course.
making this available, because if not everyone is supporting, then we won't have time to do all of these. And it is extremely important for us to be able to do them, because we just want to make sure that we have a more meaningful impact in the society that we live in. That's one of the reasons that I accepted the board seat at Brandywine SPCA. I will share more updates in the future, but there are some projects in Delaware, and we want to actually support them as much as possible. But one of the first things I told them that we can always do live sessions, and Tanner, you don't know yet, but I already volunteer you for that. So we'll be able to do events, because now we know how to do it and we have our audience, and it's more about outreach to people who may have these issues, and we'll be doing these more frequently, hopefully.
Yeah, and Kemal, same for your live sessions with Dr. Irga on Tigray, especially. I have been following them, and it's really helpful in voicing the issues of Tigray. Thanks for doing that.
Yeah, I mean, the last video right now, actually today I didn't check. It is already almost at 15,000. It's sometimes it takes time to really get to the right audience, and we have we did 4 videos. The first 3 didn't have this much reaction, but I think as more people are aware of what's happening, they are following. And then this video is already in 1 week, and we are almost at 15,000. And I'm hoping that we are not looking for any return for ourselves. We are all we are expecting is the meaningful impact that we can have, and we can also expedite the resolution for any of the issues that we have. So I'm hoping this would be possible, and we can see them all together. Well, Beste, Tanner, thank you for joining me today, and
thank you.
Have our bariatric event starting at 1, which is in 8 minutes. Dr. Erkan will be with me. We are going to talk about the cost of bariatric surgery. We'll be a little bit more specific with some, and we'll be back in 8 minutes. All right. Well, thank you so much. Have a nice weekend. Bye-bye.
Thanks, Kemal.
Thank you.